Tonight's Health Beat special segment takes a look at a new way for doctors to operate by navigating the brain. Minimally invasive brain surgery has been available for a while, but new technology allows them to see the brain like never before. And for stroke and aneurysm patients, it may mean not only less invasive procedures, but more effective surgery. The sights and sounds of what appears to be a typical operating room. Take a closer look. These images are more like something from a science fiction movie. But the future is now. This 3D picture is actually helping surgeons make crucial decisions while operating inside a woman's head.
You've got to really forget everything you know about surgery, everything you know about medicine in general.
At Rush University Medical Center in Chicago, Dr. Demetrius Lopes works in a small but growing area of medicine known as neuroendovascular surgery. Just as other physicians are able to fix the heart without a major operation, minimally invasive surgery is now possible in the brain. Some call it drill-free brain surgery. 29-year-old Anuja Mehta calls it an amazing option.
It is a very cool thing. People don't really quite believe it yet.
Anuja is nearly up to full speed just 9 days after this surgery for a brain aneurysm. A more traditional approach would have required weeks of recovery.
If I could get just as good results without doing into open surgery, I thought that would be better for me.
With this type of technology, we're finding that we can offer some treatments to patients that before we could not treat.
Repairs in the brain can be made with tiny devices delivered through a catheter, inserted near the groin, and then fed up through a blood vessel to the brain. Getting to the problem is one challenge. Being able to fix it is another. That's where this advanced imaging comes in. As the surgeon negotiates the twists and turns of the blood vessel, a computerized 3D image can be rotated to view from any angle.
Right there, that's an aneurysm right there. Perfect shot.
For example, Dr. Lopes knew this patient had a brain aneurysm, but he wasn't sure how big the problem was. These highly specialized x-rays and some amazing software helped him to see the aneurysm was bigger than they thought and helped his team determine what to do next. They filled in the weakened area and placed a stent to secure the blood vessel.
As you're doing your surgery, you can actually check and make sure your repair is looking good.
The hope is this will not only make the surgery safer, but also more precise. Whether this type of surgery is more accurate is still debatable. The technology is so new, there isn't enough science to prove patients' outcomes are better. Still, doctors want patients to know this option exists.
If I can offer the patient to have the same surgery done without having open surgery, that makes a huge difference.
Rush claims to have one of the most cutting-edge endovascular suites, but many other hospitals also offer minimally invasive brain surgery. And just because it's high-tech or less invasive does not always mean it is the best choice. Each case is different, and there are doctors who say traditional open brain surgery is still a good option.